So today we have with us Marianna from the September 2024 cohort with the IONRP program. And I am so excited to talk with her a little bit about her experience throughout the program this past year.
Hi, I'm Marianna. I work nights at the Ridgeview Emergency Department.
And Marianna, I'm curious, how have you been able to apply the concepts covered in our residency program to the area that you work in, working in the emergency department?
I found that there are a lot of concepts that I've been able to apply, specifically kind of like when the habits and routines module was super great to hear kind of your point of view on working nights and also other residents' point of views on like working nights and how to switch back and forth and finding a routine that works. It's kind of nice to be able to see what other people do and try it out and then kind of figuring out what works for you. It's also nice to be able to talk to other residents about their experiences and kind of knowing that you're not the only one kind of struggling to adjust to nights and that it's a shared experience. I also thought that kind of the changing conditions module was super nice because it gave me confidence in contacting providers. In the emergency department, we're lucky that our providers are sitting kind of just down the hallway and we can go walk over to them. But it still kind of is kind of daunting to be able to talk to them. So being able to have kind of tips and tricks to talk to them was something that was awesome to apply.
Yeah, I love all of what you just said. I know that night shift, it can be very difficult. And also with that provider communication, sometimes I feel like it's even more intimidating when you have to talk to them face to face versus making that phone call. So I love that you were able to get some of those tips and tricks that we share in the program to help with those interactions. So we have you do that professional experience, kind of the second half of the program. If you just want to share what your focus has been with that and how it's been going.
For my professional experience, I've been doing a case study. I've been looking at patients that are boarding in the ER and kind of how we can make the experience better for them and also better for staff. So I helped make schedule templates as a way of having like a daily schedule created for patients so they knew what to expect every day and kind of keep some kind of regularity in life when it's not really regular to be in the ER for so long. And I was also hoping that this tool can make transitions between staff easier. In the emergency department, staff can sometimes switch every 4 hours for a patient. And it kind of was to help make it easier to have a set schedule for the patient and help kind of create continuity of care.
Yeah, I love that. And I'm so excited to hear more about the implementation of that and how it's gone and kind of how it helps with those patient outcomes. I worked in a small hospital and there would be times where we would have people in the ER for multiple days at a time. So I just love that you were able to recognize that and hopefully help with their outcomes a little bit too. So great job on that. Mariana, what have you found to be the most beneficial aspect of the program?
I think the most beneficial aspect for me was to be able to connect with other new grads on my unit. There's a lot of nurses that have been working for 5, 10, 15, 20 years, and they're really good at putting in IVs and they just look like so comfortable and they know how to do everything. And as a new grad, that can sometimes be daunting to look at that as I don't know like how to do that or I'm not like at their level yet. And to be able to talk with other new grads and know that there's other people experiencing the same things as you was super nice and kind of validating when you're new.
It's hard to remember when you're seeing those nurses so confident to think that once they were in your shoes, but someday too, you're going to be that 5, 10 year experienced nurse and have all the confidence too. And you've come so far this year, and I know I am so proud of you. And anything else that you'd like to share with current or future residents?
I think the main thing for future residents is that to kind of gain confidence, I think everybody's always trying to gain confidence on like as a new nurse. And I think the thing that's helped me most is making friends on the unit. I think having your go-to people and being confident going to other nurses and techs or other staff on the unit has just made going to work so much easier and made my confidence increase.
Well, Mariana, thank you so much for being with us today and sharing your experience, and good luck in all you do.
Thank you.